Hello and welcome everyone to Insights. I'm Nnamdi Odipo.
And I'm Elizabeth Omori. Thank you for joining us.
Have you noticed how the month of October focuses attention on some particular health problems and medical conditions? As is the practice globally, organizations and communities actively take part in promoting and supporting many World Health Days observed to draw attention to these health issues. I will, on this episode, focus on at least two of these global public health awareness days and appraise how they help in raising awareness on the importance of healthy lifestyle and well-being amongst the general population. Elizabeth?
Talking about well-being, we will be a bit gender sensitive on this episode because we'll be taking a look at the fundamental human rights of the girl child and how these rights help in cascading her goals to reality.
Very well then, let's begin.
Whatever the issues are,
the National Assembly is constitutionally empowered to scrutinize,
however complex or intricate.
We have involved all the academia, the members of the academia. We have involved the academies.
Be it government policies or in fact any issue of public concern.
Our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of agreements in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
And gaining understanding is also getting insight.
You're watching Insights. Let's begin with the Global Handwashing Day, an event marked October 15 every year. As simple as it may seem, handwashing remains a potent weapon against disease transmission and a crucial aspect of public health. Despite its importance, access to clean water and sanitation remains a challenge in Nigeria, exacerbating an already bad situation. Where exactly are things with regards to access to water and sanitation in Nigeria? What are the high-risk settings and who are the vulnerable populations when it comes to preventable or neglected tropical diseases in Nigeria? And in terms of advocacy, what are we seeing in public behavioral change and community engagement? Not forgetting to query evidence-based guidelines for hand washing. Let me bring in my guest, Jane Bivan, Chief of WASH, that's Water, Sanitation and Hygiene with UNICEF. Last October, we had UNICEF here with us in the studio to discuss the same issue. I reckon we should get a status report since an entire year of advocacy has since passed. I'd like to welcome you to Insight, Jane. Thank you so much for joining us on the program.
It's a pleasure to be here with you.
Right. What progress report do you have for us? I mean, in terms of the progress that Nigeria may or may not have made in the last year with regards increasing access to clean water and sanitation, and what challenges persist, particularly in rural and marginalized communities?
Thanks so much for the question. It's a real challenge, to be honest, hand washing in Nigeria. Our data tells us that only about 11% of people are actually washing their hands at the critical times that really makes a difference for disease prevention. And this is a crucial part of daily hygiene and behavior change to really make a difference for disease prevention. So in terms of progress, there's been lots of advocacy, lots of community mobilization, and lots of campaigns, particularly around disease outbreaks. But I think with reference to the various disease outbreaks of cholera recently and monkeypox as well, all of these can be very much minimized with the simple act of hand washing.
Great. You just referenced cholera. Not too long ago, we had this massive breakout across the country. How much of that contributed to what we witnessed back then, and how could it have been avoided?
Well, cholera is related to drinking water and the spread of fecal-oral disease. So it's not just hands. Obviously, if you're drinking unsafe water, that's another reason for catching it. But certainly the spread through food, if it's prepared with unclean hands or if it's passed on with unclean hands, can really spread the epidemic. So the safest thing that you can do, and anybody can do, is to wash your hands before you eat, after you defecate, and whenever you're preparing food.
Great. Beyond the issue of access, I mean, which you've referenced already, what do you consider some of the primary behavioral and systemic barriers hindering effective hand washing practices in Nigeria? And do you think they're being addressed? If they are they being addressed?
Well, that's a kind of million-dollar question because it's a problem all over the world, of course. But nudges that we found that really help is working with school children, because if you can instill a behavior like hand washing at school age, you're far more likely to carry it on into your adult life. So I would say strict enforcement of hand washing at schools before anybody eats is really important, and after the toilet. Simple reminders like posters in the toilets to remind people to wash their hands, and behavior change promotion such as making the facilities more available. So just for example, if we were in a meeting and then lunch is called, if you had a sink and a tap on the way to lunch so that everybody had to literally pass by it and refuse to wash their hands, I think most people probably would wash their hands. But the trouble is, you know, having to make a diversion when you've got food on your mind maybe is not the easiest thing to do. So it's really important to please remember just to make that extra effort to wash your hands.
You know, when, again, I'm taking you back to the issue of cholera, and I'm saying this because we know in these parts that certain preventable ailments or diseases are referenced as poor people diseases, you know. Hand washing is a practice that should generally cut across. It doesn't matter whether you're poor or you're rich. You know, basically, it's like we said, it may seem simple, seemingly simple, yet it is a potent weapon for preventing preventable diseases, like we said. And and even though I know advocacy has dialed down and hammered down on the proper way to wash one's hands, would you just quickly take us through that? And I mean, the proper way for hand washing now, whether you use running water, or I could use a scoop to wash my hands. And while talking about that, I would like for you to also reference why hand washing should cut across regardless of class, economic class that is. And now, even in vulnerable communities, there can be, you know, some measure of propagating behavioral change, especially when it comes to the issue of hand washing. Maybe there's no running tap in the poor or rural, you know, community, but then can we have things instituted in such communities to also engender behavioral change pattern for hand washing in such communities?
Well, thank you for the question, but I do think it's a common misconception that it's a problem of rural communities. In fact, the biggest outbreak of cholera we've had this year has been in Lagos. And it's far more to do with the density of population than it is anything else. So where people are living very closely together, where they're all using similar facilities, and often the water is unsafe, this is where problems can arise. So yes, it's best to use running water, ideally, and soap, but in the absence of running water, also a bowl with soap is fine. But the key point is that you should be using soap and not just water for really getting your hands clean. So those are the main issues. And so yes, I think it's more of an urban issue, because there we have the crowded populations, and it's not just an economic related thing, it's far more to do with everybody, because my neighbour's uncleanliness, if you like, will eventually affect my own home, because we're all using the same facilities in the area. So it's really important that this is a collective movement, and that everybody encourages their families and their friends and all of their colleagues to wash their hands. Thank you.
Great. So when I referenced cholera, I did not mean that it's prevalent in rural communities. I just meant in terms of impact. I mean, it's quite popular when they say it's more amongst poor and vulnerable persons. That's why they call it the poor man disease, essentially. So that was why I brought that up. But I also wanted you to dial down on perhaps maybe illustrate successful behavioral change initiatives or community-led programs, promoting hand washing, sanitation and hygiene, again, resulting in significant disease reduction.
So I would say that sanitation coverage is really closely linked with hand hygiene, because wherever we have good sanitation coverage and everybody has toilets, most likely they have hand washing facility in that. That's part of the national definition of safe sanitation in Nigeria, is including a hand washing facility. So wherever you have a good toilet, it's expected and hoped that you would also have good hand washing facility with soap. An example I can give is the very ongoing situation in Maiduguri, where we have, the terrible floods that happened across the city, and many people lost their homes and have had to move into very temporary camping situations. And of course, we have inevitably, unfortunately, had a few cholera cases there. But UNICEF and partners working very closely and round the clock with all of those vulnerable communities to really promote hand washing and hygiene, to encourage the use of safe water, and to really ensure that the spread of the disease is minimized.
When you say UNICEF and its partners, I wonder how the Hygiene Behavioral Change Coalition in Nigeria facilitates public-private partnerships to especially advance sustainability and social value in vulnerable communities especially.
So definitely there's a lot of private sector partners involved in hand washing, and I think you'll see that in evidence at the Hand Washing Day celebration events. So partners are really involved at different levels, both at policy level, but I think mostly at the implementation level, in terms of supporting local communities and schools and institutions to promote safe hand washing.
Okay, great, perfect. Now let's talk about some perhaps tailored wash interventions and strategies that have been quite effective in high-risk settings, like the IDP camps you mentioned earlier when you talked about what took place or what happened in Maiduguri. I wonder how some of these interventions have managed to improve health outcomes and ultimately reduced morbidity.
Well, I think this is slightly the problem, is that when we promote hand washing in an emergency and then the cholera stops, people think, oh, we don't have to wash our hands anymore.
Great.
So
you see, and that's a problem there.
Yes.
That
is really a problem right there. And so my concern is to ensure that it's a lifetime behavior change, not just an emergency behavior change. So
yes,
we promote that all of the time.
Great, but what is advocacy doing in that regard? And of course, like I said, the Hand Wash Initiative Coalition in Nigeria, UNICEF, its partners, perhaps government and all of that, in entrenching sustainability so that it's not a one-off. People don't just wash their hands today and then they get better.
Yes.
And then the day after, they go back to the same behavior that puts them in the problem in the first place.
Yes, of course. So you may have heard of the Clean Nigeria campaign that promotes sanitation across the country. And this is chaired by the Vice President himself and led by the Ministry of Water with its partners. And the Clean Nigeria campaign, Use the Toilet as it's called, is inclusive of hand washing behavior. And so every state has a roadmap for ending open defecation, and that includes improving hand washing coverage. So every toilet that's built, as I mentioned before, should also have a toilet hand washing facility integrated into that. So we already have one full state, Jigawa, that is completely open defecation free, and in principle everybody in Jigawa is also washing their hands at all times. Obviously its behavior change doesn't happen overnight. There's a lot of follow-up that needs to happen. But it's a really good progress, and there's several other states that we hope will be on track soon also to be fully open defecation free.
You know, we would end on the issue of progress, like you've talked about, and what you foresee in the days to come. But just before then, I'd like to take you back to when you referenced the issue of soap, having to use soap to wash one's hands. I wonder what evidence-based guidelines exist for hand washing techniques. You know, antibacterial soap usage perhaps, or maybe hand sanitizers effectiveness. You know, what should the public basically know about all of these, and what and which to use and what to do?
Mm-hmm. Well, it's really not complicated. I think you can feel when your hands are clean as well. But ideally, soap is probably the best. Hand sanitizer is also good, but it's not necessarily ending up feeling so clean, I think. Everybody's experienced that can be quite sticky. Yes, it's good in the short term as an option, particularly if you don't have access to water. But I think as well, more sustainable is the use of soap. Soap is really not an expensive commodity, and everybody has it in their household. It's just a question of how accessible it is for hand washing when you've used the toilet.
Okay, so I'll paint you a scenario, Jane, and you tell me what you think of this. I find myself perhaps somewhere where I do not have access to soap. I do not have access to hand sanitizer. And I need to wash my hands because they feel dirty, and I know they are. Mm-hmm. And I see a log of wood, perhaps that has been used as firewood, and I pack some hash, and I have access to water, and I use the hash to wash my hands.
Yep.
You know, and does that work?
It does work. It's anything abrasive, honestly, even grit can help to remove dirt from your hands, which is better than nothing. So yes, definitely ash does work, but it's second after soap, I would say.
Great. And then I said we were going to conclude on what you think the future holds for the WASH campaign in Nigeria, based on the progress that we've made, not just in the last year, but in the build-up to the launch of the campaign, and all of the interventions that you've seen so far, including UNICEF's intervention and collaboration with the government. What do you foresee in the next few, not just next few days, in the years to come, in terms of the WASH campaign here in Nigeria? Do you think the targets that we've set for ourselves nationally can be achieved if the tempo is sustained on some of the ongoing interventions?
Well, that's a really good question. The goal for 100% coverage globally is, of course, the SDG goal of 2030. So we have just 5 years and a bit to achieve that. We currently have about 135, I believe, LGAs that are open defecation free, and I think we can do this because I see that things are snowballing now, that states have really got the bull by the horns, and they're heading towards open defecation free status. I've seen Kaduna recently, I've seen Benue, I've seen Katsina. All of these states are soon going to be fully open defecation free, like Jigawa. But there's some states that still have to get off first base, so this is an urgent plea to everybody to please consider becoming open defecation free, because it's such an important thing to help your children, to help the future of Nigeria. Thank you.
Jane Bivan, Chief of WASH, UNICEF Nigeria, I'd like to thank you so much for joining us on Insight. Thank you so much indeed.
It's my pleasure. Thank you.
Moving ahead, in the week just past, we saw news headlines across platforms in mainstream and social media capture the essence of the federal government's effort to strengthen mental health care in Nigeria. Most of them highlighting the launch of the Mental Health Gap Action Program 3.0 and the inauguration of a national task force on the criminalization of attempted suicide. All of this come as Nigeria joined the rest of the world to mark the 2024 World Mental Health Day, commemorated October 10. My next guest, Dr. Muftar Mohammed, is a consultant psychiatrist at the University of Abuja Teaching Hospital, Gwagwalada. Dr. Mohammed is also the founder and chief executive officer, Safe Brain Organization. Doc, tell me a bit about that Safe Brain Organization and how your advocacy with your group impacts mental health issues.
Yeah, thank you very much. The Safe Brain Organization is a non-profit charity that's specifically dedicated to supporting the mental health and well-being of children and young people. We do know that there's a huge burden of mental health conditions among children and adolescents.
True, and that's why we're here to talk about all of that. I mean, let me just formally welcome you to Insight. Thank you so much for coming on the program. Just before I bring our... you're welcome. My pleasure to have you here. Just before I bring our conversation around to the theme of the 2024 World Mental Health Day and the rationale behind that, I would like for us to begin with discussing, what the World Health Organization, of course that's WHO, describes as Nigeria's mental health crisis. I went through all of the figures and I must say they are mind-boggling. Do you concur with WHO's verdict that 1 in every 5 Nigerian, I beg your pardon, is affected by mental illness, putting that figure at an estimated 20 million Nigerians? What's your assessment of such a truly troubling and staggering crisis?
Yeah, so that's mental health conditions are really common. The World Health Organization estimates that 1 in every 4 people is at risk.
5, as a matter of fact.
Yeah, one is at risk of developing a mental health condition in their lifetime. That's actually considering the whole of the life span of an individual. So if we consider an estimated population of Nigeria of 220 million, so we do know that about over 50 million people are at risk of developing a mental health condition in their lifetime. So that's really a huge burden, and it's something that's global. But unfortunately, over 80% of those who need mental health care are not having access to evidence-based care that they need.
And there are a whole lot of factors responsible for that and driving that. And that brings me to, of course, my next question. When I hear that some of Nigeria's most prevalent mental illnesses include depression and anxiety disorders. On top of all of that, I also hear that substance abuse disorders, bipolar disorders, schizophrenia and personality disorder are also quite common here in Nigeria. What are the driving factors for this, and why is it that some of these driving factors for these mental health issues and illnesses are associated with PTSD, conflict and violence, as well as natural disasters?
Yeah, so there are there's a wide range of mental health conditions. When you look at childhood, some begin in childhood. For example, developmental conditions such as attention deficit hyperactivity disorder, autism spectrum disorders, and other neurodevelopmental conditions. In adolescence, we have other conditions starting like depression and anxiety, and also psychotic disorders like depression. While in later life, we have other conditions like dementia that set in. So a wide range of mental health conditions occur at different stages of the lifespan. We do know that many conditions, many circumstances we call social determinants of mental health can actually increase the risk for people to develop mental health conditions. As you rightly said, circumstances of adversity, for example, experiencing insecurity, conflicts, and other disasters can actually increase the risk for people to have mental health conditions. While also things like constrained circumstances, constrained resources, for example, financial crisis can also increase the risk for people to have mental health conditions.
Doug, do you know why I chuckled? When you mentioned financial crisis, isn't that a problem that more than half of Nigerians are currently facing? financial constraints and issues. Does that mean, well, you already, WHO and you already concurred with the figure, but does that further exacerbate an already bad situation?
Yeah, absolutely. People have different, although the different people will have different vulnerabilities to developing mental health conditions. Despite these circumstances, some may not really develop mental health conditions, while others will have increased risk of having these conditions. So it depends on individuals' resilience and how people respond to adversity. So people with limited emotional resources for tolerating stress, for example, will have higher risk of having a mental health condition in these circumstances.
So how do people build resilience, you know, to be able to, well, manage stress? Because I hear that mental illnesses have a significant real-life impact on many Nigerians. And okay, maybe that you know, let's just dial down on the theme of the 2024 World Mental Health Day, which gives priority to mental health in the workplace. I mean, you've talked about stress, and we know how stressful, you know, the workplace can be. How can organizations, I beg your pardon, create an enabling environment to foster healthier mental health for their workers? We're talking about building resilience here. How can organizations come in and assist in creating such an enabling environment at this point? Because it has become an issue. Workplace stress-induced mental health issues, you know, in the workplace.
Yeah, absolutely. The theme for this year's World Mental Health Day centers around making prioritizing mental health in the workplace. We do know that the work environment can really be stressful, in different sectors, and difficulties with managing resources and experiences of other problems within the workplace can really increase the risk for having problems. So bullying within the workplace or experience of stigma and discrimination, people with mental health conditions may be discriminated against, which may not allow them to openly discuss their condition, and that will really make them to suffer in silence, and that can really increase their risk for having difficulties and not being productive at work. Because when we look at the World Health Organization definition of health, it's a state of well-being in which everyone realizes their own potential, is able to cope with the normal stresses of life, work productively and fruitfully, and make a positive contribution to society. So for we to achieve the full potential of the workplace to produce productivity and prosperity, and for people to make positive contributions to the society, there's a critical need to address stress-related issues within the workplace. And part of it is ensuring that managers are equipped with the skills to support their teams, to learn about mental health so that they do not engage in activities that can cause stress for people and increase their risk for mental health conditions. And for them to really understand that they have to show empathy and compassion for all people working in their company, for example.
Great. I mean, you are a professional in this field. I reckon you've seen a lot. But then I would like your thoughts on the issue of shortage of mental health professionals in the country. On this, I have a couple of questions for you as regards, you know, this whole issue. First, I'd like to know, what is the standard practice of care for a psychiatrist in terms of care for patients? How many psychiatrists to how many patients, for instance? And do we have that in Nigeria? Secondly, you know, I was going through the records of the Nigerian Association of Clinical Psychologists, and I noticed how there are only 319 licensed clinical psychologists in Nigeria, of course, registered with the organization. Isn't that grossly inadequate and a non-starter, especially when you consider that psychologists are key professionals in providing services for people with mental health conditions?
Yeah, absolutely. There is a huge shortage. There is for mental health professionals in Nigeria. In Nigeria, for example, we have one psychiatrist per about 1 million population. This is against the World Health Organization's recommendation of one psychiatrist per 100,000 population, which means there is a huge gap, in terms of the mental health workforce. And this also is even worse with other members of the multidisciplinary mental health team, like clinical psychologists and other occupational therapies and so on.
Dr. Mohammed, does the jackpot that we've been experiencing lately, does it factor into the equation in any way? Because I was reading of the story with the Yaba, the health facility in Yaba, and how it has experienced, more than half of its doctors, its psychiatrists and psychologists have all left the institution to seek greener pastures abroad. Is this a factor impeding and contributing to this widening gap that we're experiencing within this field?
Yeah, absolutely. One of the major reasons, why we have this huge gap in mental health workforce is the brain drain. The so-called brain drain, where health professionals, experienced mental health professionals, leave the country for better opportunities outside the country. And that's actually perpetuates the treatment gap. But I think efforts to address that by increasing the number and increasing the remuneration for mental health professionals can really help in retaining, our workforce, so that we provide for the population in Nigeria, because the gap is really huge. Over 80% of those who need mental health care are not having access to the care they need. So we have the gap widening. Developed countries are, having these people trained in Nigeria, having all the benefits. But I think we can also do good by improving the conditions for people, so that we can retain the workforce in our country.
Dr. Mohammed, I'd like for us to conclude, finally, with your thoughts on, the severe stigma faced by people living with mental disorders, and how advocacy is, whether or not advocacy is turning the tide on mental health treatment provided through non-orthodox means. Are we witnessing a shift in the numbers, especially those who seek out treatment from traditional and supernatural healers, for instance?
Yeah, so the treatment gap is quite huge, and one of the major drivers is stigma.
Yes.
People access, why we have more than 80% of people with mental health conditions not having access to the appropriate support they need, is the fact that they access other forms of care, like spiritual or traditional forms of medications, which may not be have any evidence base, and they continue to suffer, without having the support they need. So I think stigma is one of the major factors. Most people access these forms of care because they think.
But I reckon organizations like Safe Brain and other sister organizations and agencies are putting in some work in this regard. Are you seeing results?
Yeah, absolutely. One of the core at Safe Brain organization, which is a non-profit charity dedicated to supporting the mental health and well-being of children and young people. One of the major areas of work for us is reducing the stigma, engaging in advocacy efforts to reduce the stigma associated with mental health conditions, particularly among children and young people. We do know that over 50% of adult mental disorders begin before the age of 15, and up to 70% before the age of 24. So most of the burden of mental health conditions is amongst young people. Unfortunately, they do not have access to the care they need because of stigma and a range of other factors. So addressing stigma is one of the major areas we work on at Safe Brain organization.
And I hope we put in some more work in that direction so that, you know, this cloud of ignorance and is cleared off and people are able to, patients are able to access treatment through orthodox means and not non-orthodox means. Dr. Muftar Mohammed, consultant psychiatrist, University of Abuja, Teaching Hospital Gwagwalada, founder and chief executive officer, Safe Brain Organization. I would like to thank you so much for coming on Insight. Thank you so much indeed.
Thank you very much for having me. Thank you.
Elizabeth Omori is up next.
Putting an end to harmful practices and support children, UNICEF works with countries to galvanize political will, develop laws, provide health care to girls affected by female genital mutilation, and mobilize communities to change behaviors. Nigeria is one of the countries working with UNICEF to promote the rights of the girl child. Multiple reports have it that Nigeria is one of the countries to likely experience increase in child rights by 2030 and double by 2050. This year, as we celebrate the Nigerian girl, we will look at issues hampering her growth from family to society. And I have great intellects to speak with us on this issue. I have Fumilayo Oyekomi, a gender advocate, and Peace Daful of Aspire Women Forum. Ladies, thank you so much for joining us on Insights.
Thank you for having me.
Thank you so much for having us, ma'am.
Thank you so much. Now, let's begin with the protection of the girl child. Are the rights of our girls truly protected? I'll start with Peace.
Okay, ma'am. So talking about the rights of the girl child, are they truly protected? I would say yes and no.
Okay.
Because when you look around you, from family to society, and from the way government handles our girl-child-related issues, you would see that even though civil society organizations has been working, we've been trying to create awareness. The government has been trying. We would want to applaud the effort of the government so far because they've been trying in ensuring that the rights of the girl child are being implemented. And also we want to appreciate civil society organizations for all their efforts. They've been doing a lot. For instance, the Aspire Women Forum, we've been doing a lot of creating awareness. We've been doing a lot of mentorships, and we've been providing platforms for young girls to thrive.
Okay, let me hear from you, Fumilayo. I know you are a lawyer in the making and a gender advocate as well. So let's hear from you. Are the rights of our girls truly protected?
Thank you for the question. So to begin, I would like to make reference to my legal background because in my practice, we've learned about laws that have been enacted, talking about the Child Rights Act, talking about the VAP Act, and we see all the promises, all the guarantees that are in these laws with regards to the rights of girls pertaining to health, education, and all those things. But in practice, we see the lacunas, we see the gaps, we see how far we are from implementing all of these things in the laws. And to make matters worse, some of these laws are what we call non-justiciable, meaning that they are limited to the economic capabilities of the government. And so when we see the gap in society, we know that we are still very far from achieving full enforcement and full implementation of the rights of the girl child. So more effort needs to be made, to complement the efforts of government. More effort needs to be made to ensure that girls are adequately protected and that more investments are put into developing their full potential.
Why are these laws not being fully implemented or effective?
The problem is usually in the implementation. How well are we implementing the laws that are in place? Recently, there was a bill at the state's National House of Assembly to repeal the VAP Act because it had some lacunas, and it just helps us to understand why some people are thinking in that light. I mean, if there is a lacuna in the law, the next thing is not to repeal, but to fill it up and to make amendments like we do with other laws.
Peace, I would like you to share with us, what are the things you do to help girls actualize their goals? What have you been doing? Would you like to share with us?
Happy to share. We encourage these young women to know that they can always reach their full potential regardless of their background, regardless of their gender, age, and social status or anything. So we have different sets of different programs that we've been having for the young girls and for young women. We go to the grassroots and create awareness, because sometimes the problem is people back there at home or back in the grassroots or even in urban communities are not aware of some of the rights of the girl child. And you know what is killing us is lack of knowledge. You have to know something to be able to know if there is a problem with that thing or not. So most times, these people don't even know what the rights of the girl child are. You meet a woman who has 5, 6 girls and she doesn't know that her child has a right to education, has rights to health care facilities, has rights to so many other things. So these are the issues that often affect. So we go back there to the grassroots, we go back to our mothers, to young girls, because young girls are the ones who eventually become mothers and leaders tomorrow. So we go back to these young girls and we create the awareness, let them know about the rights of the girl child, teach them what we can do to help them to be able to push through to us to attain their full potential.
Okay. All right, for me, in actualizing the cause of the girl child, as a gender advocate, what have you been doing? What impact have you been making?
One of the core programs we do for girls is called the Girl Power Program, where we go and educate marginalized and girls from vulnerable communities on different areas. We are taking the approach of gender-responsive education, which acknowledges the challenges that girls face in society and looking at how we can close the gender gap in poverty. And every year, we run this 6-month education program that focuses on teaching them things in 6 different areas, talking about financial literacy, helping them to understand how to save, how to build wealth, teaching them about careers in the STEM field, and teaching them about academic excellence to encourage school retention and encourage them to pursue higher education, teaching them about sexual and reproductive health. And all of these things is how we ensure that girls are properly equipped and have solid foundations to build prosperous futures.
Okay. You know, before we became ladies, we were once girls, and then several factors affect the development of the girl child. What are we doing to make them actualize their goals? I'll start with you. Again, peace.
Okay, thank you very much for that wonderful question. The mindset of the parents, not just the mothers in this case, because even the fathers are involved, it begins with what we tell our girls, how we raise them. Some parents will tell their girl child, you shouldn't stand up to a man when a man tries to bully you because he's a man and he can beat you. I believe that there are ways that you can defend yourself as a girl child, without resulting to physical attack, because obviously most times the men would overpower you. So you teach them how to use emotional intelligence and psychology to handle certain situations that life throws at them. It's baffling that when you gather a group of young girls, 5, 10 girls, you'll be surprised at the number of girls who have experienced one form of abuse
or the other.
Yes. As little as 1 year, 2 year, you would realize that these young girls know something, even if they don't know how to put it. When you try to describe some certain forms of abuse, they would affirm to it because yes, something similar or something of that sort has happened to them. So it's really very sad, because it boils down to parenting, how we raise our girl child, what the society says is okay for the girl child to do and say, and not to do or say. So this, and it's not just about training the girl child, even the boy child, because we do a lot for the girl child, and at the end of the day, if we are not telling these guys that, oh, this is a girl, this is how she should be treated, these are the things that should be done and should not be done to her, we're getting it wrong, because at the end of the day, the women don't live in the world of their own, we live with the other gender. So I believe that these young men have to also be aware of the problems and the effects of their words and actions against women.
All right, for me, from her explanation, equity is actually very key. But is education the only key to helping a girl child actualize her dreams?
No, education is not the only key, but it is a very fundamental key. We should begin to understand that beyond education, there are different things that affect a girl child's development. You know, hearing from my other speaker talking about parenting, there is also the environment, there is the home front, there is the church or the mosque for those that practice religion. There are different things that affect the girl child development. You know, when you are constantly told that you cannot amount to anything, or you are faced with gender discrimination, even though you are educated, there is a certain form of limitation that you are still bound by, because you have not begun to see yourself as someone that can achieve more than your immediate environment. A lot of these communities that we have gone to empower girls, we ask them, oh, what do you want to be before the actual program? And some of the answers reflect their limited mindset, but with reorientation, we are able to help them to also equip them with life skills. So there is the foundational literacy, which is the education, but then there are life skills that you must also teach girls to complement what they learn in school, for them to get to that point where they are leaders in society, and they are making waves in different industries, in politics, in different areas of life.
Okay. Now, in changing the narratives and building the confidence of our girls, what are the steps we can take? What can we do to ensure that women become who they want to be positively to affect their immediate society? Peace.
Thank you very much for that question. And again, I would like to take you back home, because whatever happens in the society starts from the home.
A reflection of the home.
Yes, it reflects how that person has been raised, and how the community that person comes from views certain issues. So I would say that we need to go back home. It's an assignment for everybody at home to have a rethink. What are we saying to the girl child that we are raising? How are we raising these girls? What are we telling them? Because a girl wants to be an engineer, we say, oh no, that's mainly for the men. A girl wants to be this, and we are bringing up so many stereotypes and so many things to relegate her and keep the girl child in the background. So a typical girl from an average home would just tell you, I want to be a nurse. And if you ask, why don't you want to be a doctor? They say, mostly it's men that are doctors. And it's really sad. Say, I want to be a carpenter. You say, why not an interior designer? That's more ladylike. So it boils down to what we tell these girls. Because somehow we are the ones, the parents are the ones that are limiting the vision that these girls have. We need to start telling our kids that they can be who and whatever they want to be, who and anything they desire to be. If you can visualize it, you can of course achieve it. So it begins with the mind. The mind is the most powerful tool there is. So it begins with how you develop the mind of the girl child. Women don't have to end in the farm. They don't have to end getting married as child brides, because statistics from the UNICEF, we have statistics from UNICEF that says that 1 out of 5 girls get married before the age of 18, which is a very sad reality today. Although from 2010 up until now, there's been a little decline. We can applaud that. It's a step forward, but it's not enough. We want to call on the government to also implement policies and strategies that would help us curb these challenges that the girl child is facing. Thank you.
All right, Fumi, let's hear your thoughts.
Okay, so for me, I would say that we need to show girls role models. So I know that a lot of organizations have mentorship programs, and they create forums and spaces for intergenerational connection, and for girls to be inspired by older women that are breaking glass ceilings, which is a step in the right direction. And I would say that, building on that, we should make efforts to reach the girls that don't have access to, for instance, the internet. There are a lot of girls that need this intervention very quickly, and they are not on the radar because of, poverty. We need to make efforts to access and even provide tools, and that is one of the reasons why, we are thinking of creating workbooks for girls on the different areas that we educate girls on, so that they can have these books with a lot of insights and content and resources to build that knowledge, to have access to adequate resources and information. Synergy helps us to go a long way in providing holistic interventions for the girls. We know that girl issues cut across many facets. We look at health, we look at education, we look at poverty. We see how everything is interconnected, which calls for more synergy and more partnership. Teachers also play a big role, and by the time we equip the teachers to also be role models.
Fumilaya Oyekomi and Peace Daful, I want to thank both of you so much for joining us on Inside this week, and thank you so much for your thoughts on the issue before us. Thank you very much.
Thank you for having me.
Thank you for having us, ma.
What are we doing as a nation to first of all settle our teeming populace, especially the
NTA's political package with a third eye on the nation's political scene? I am Fisa Ogunfuyi. Welcome.
You have to be very careful giving space to people who are obviously sponsored to further the agenda of some other groups.
There's a lot of questions. A lot of questions in a closed door sessions. Some of these issues, some of the problems bedeviling of their.
In fact, between June 1st and July 17, 19-point-something billion has left the coffers of the NDDC.
I can say my constituency, they need everything because we don't have anything.
And that's it on this episode of the program. Do join us same time for more on Insights. My name is Nnamdi Odipo.
And I'm Elizabeth Omori. We'll see you next week. Bye for now.